Welcome to the PinkpillRx podcast, hosted by Katie and Jay Fillmore, where we navigate complex and thought-provoking topics surrounding women with a focus on education. For shorter form content, follow us on TikTok, Instagram, or YouTube at Caters88 or PinkpillRx.
That's KATORS88.
If you enjoy this podcast, please give us a follow and maybe a nice review.
I do want to warn you that this could be a very triggering episode. It is graphic. I go into detail about medical procedures and different atrocities that have happened to women in marginalized groups. And I just want you to know that ahead of time. So today we're talking about the history of childbirth and gynecology.
Are we going to be talking about chainsaws at all?
You know what? That is one thing I did not put in here.
Because we did before.
But we can totally talk about chainsaws.
Because wasn't it invented for cutting the pelvis or something like that?
It was invented to cut the pelvis to get a child out. Yep.
Insane.
For cesarean.
Insane. And now I use a chainsaw on lots of things, not pelvises.
Yeah. Well, that's a little haunted, isn't it?
Yeah, that's like, I mean, you think of like 80s more gory horror films, chainsaws and stuff. I mean, we're right up that alley.
Right. And they were pretty rudimentary too. They were like crank saws.
Dude, and just, so crude.
Yeah, the mothers really didn't survive very much.
Insane.
In those scenarios.
Insane. You don't see them using a chainsaw on a dude.
But, they always, know what? They thought it was better to have a motherless child than a childless mother. So they would sacrifice the mother over the baby.
Yeah, I don't agree with that.
I don't agree with that either. I guess you just jumped right in with that one because that wasn't even on the bingo card for today, which it totally should have been. So good job.
Thanks.
Way to remember. We had talked a while back about midwives.
Yeah.
And
just the dismantling of their legacy.
Yes. And how they were burned at the stake.
Yeah.
A lot of them were, and a lot of that knowledge was lost and stuff.
Right.
So I'm not going to dive too much into that in this episode, but I think it is important to remember that as well, that is part of childbirth history.
That's the context we're jumping into.
Yeah. Midwives routinely attended to births prior to the medicalization of obstetrics.
Yeah.
By the 19th century, campaigns led mostly by male physicians and later by governmental regulations drastically reduced the influence and autonomy of midwives, especially in Europe and North America. And so by the early 1900s, births were moved from home mostly into hospitals. And almost all births were attended by male physicians at that point. So I want to start out with the history of gynecology. You might remember some of this from when we spoke, it was probably a year ago, about this individual.
Okay.
Marion Sims.
The name sounds very familiar.
So he was often called the father of gynecology. And between 1845 and 1849, so 4 years, Sims conducted experimental surgeries primarily in Montgomery, Alabama.
Oh, I remember him now.
Attempting to develop a technique to repair fistulas, which was a debilitating complication from childbirth sometimes. And it's characterized by like tunneling and tears between the bladder and the vagina, leading to incontinence and other things. And it doesn't just have to be between the vagina and the bladder. It can be between the rectum and the vagina and things like that too.
Yeah.
So it doesn't just have
things
to be
you don't want connecting.
Things you do not want connecting, right? Yeah. So what he did is he experimented on enslaved women.
Right.
And the quote unquote owners of these women and these enslaved women, I will call them oppressors, granted permission for him to experiment on them. What happened is these women would be like giving birth to babies, aka their workforce, right, on behalf of their oppressors, and they would have medical injuries such as fistulas, tears, etc. And so these slave owners were motivated to get these women back out and working or back out and having babies. So they were very motivated to let Sims do these experiments.
I'm tracking.
These procedures were done without anesthesia, which did exist at the time. But the prevailing racist belief that black people were less sensitive to pain contributed to the denial of anesthesia, specifically with Sims, because Sims specifically did not think black people felt pain the way that white people did.
That's crazy.
He repeatedly operated on enslaved black women who could not consent, including 3 of them that are like more of the more famous ones: Anarcha, Betsy, and Lucy. Anarcha endured approximately 30 surgeries with Sims.
Oh, God.
And
holy kid. Okay.
Yeah, no,
30,
you can sit in that.
30 30 surgeries, no anesthesia.
Right. He would rely on other enslaved women to hold the patients down during these excruciating procedures.
So obviously they're holding her down. Obviously she is reacting in pain. And what? He's just like, oh, you don't feel pain like we feel pain.
Oh,
what?
See, it's totally a double.
The hell?
Not a double standard. I don't know what the word is that I'm looking for. Because in his notes, he talks about the agony being extreme.
Yeah.
So he knows these women are in pain.
Right. And then still foregoes anesthesia.
Yes. He's quoted as saying, not at any time in any day could he not have had a subject for operation, and that it was the most memorable time of his life. The reasons we know how to repair fistulas today is because of these 17, 18-year-old girls. That's how old these girls were, a lot of them, who suffered and underwent these unmedicated surgeries.
Yeah. Oh.
So one of the girls named Lucy was 18. She couldn't control her bladder after having a baby. Mm-hmm. And during the procedure, the patients were asked to perch on their knees, bend forward on their elbows so their heads rested in their hands. And Lucy endured an hour-long surgery, screaming and crying out in pain, as a nearly dozen doctors watched. Sims would later write, Lucy's agony was extreme. I thought she was going to die. It took Lucy 2 to 3 months to recover from the effects of that one particular operation. And there was many operations. Like I said, the 17-year-old Anarcha had 30 operations. And those are just 2 of the women. And he did this for 4 years. There are so many women. So after 4 years, he perfected his method. And then he was able to do it on white women. But guess what?
Anesthesia.
He used anesthesia for them.
Yeah.
Before and after his experiments on these women, he would experiment on black babies without pain medication. Oh. One of the things he experimented on children for was to treat neonatal tetanus, which was a form of tetanus most likely caused by used and unsterilized equipment to cut the umbilical cord. Mm-hmm. He had very little success, though, in these experiments. Why? Well, he believed that African Americans were less intelligent than white people and thought it was because their skulls grew too quickly around their brain. And he would operate on African American babies using a shoemaker's tool to pry their bones apart and loosen their skulls.
Oh, these little babies.
So in the 1850s, Sims moved to New York and opened the first ever women's hospital. Wouldn't you feel safe there? Where he continued to test medical treatments on black women and children. And anytime a child died from his experiments, he was never to blame. He would write, the blame laid squarely on the sloth and ignorance of their mothers and the black midwives who attended them.
And no one fought him on it.
No, of course not. He's a white man. Sims also invented the speculum that has undergone very little to no innovation to this day.
Oh, that's the metal thing?
Yes. The speculum is a tool that's used during a pap smear that some you up in many gynecological procedures.
You think they'd make it more comfortable by now?
You would think. Now, granted, there has been some are plastic, some are metal.
Are there rounded edges?
They do have rounded edges. Some do have smaller bills, that go inside.
Yeah.
But it was developed and always meant for the ease of the use for the provider and had no regard for the pain it caused the patient. That's not why the speculum was not invented for the comfort of the patient.
Yeah.
It was for the convenience of the provider, and it still is. There are other countries where they just don't even use speculums. Like they'll even let you do your own swab for your pap smear. It's interesting.
Oh, do you
That's
think
an interesting rabbit hole to go down.
I honestly don't even know what a pap smear is.
Okay, so they open you up with the speculum, right?
Yes.
They go in,
get something
with a little scraper thing.
Sorry.
And they scrape some cells off your cervix.
Cervix, right.
And then they send it to the lab.
And it's checking for cervical cancer?
It checks for cervical cancer, abnormal cells, yeah.
I mean, that's up there. Because the cervix is like, you got to go up a little ways, right?
You do got to go up a little ways.
So, I mean, that's got to be it's got to be painful. Is the pap smear painful?
Pap smear is not comfy. No. It's not a comfortable thing.
The scraping and the speculum?
I mean, because remember, they don't think that for the longest time, didn't think that women had nerves on their cervix, right?
I forgot about that.
So, of course, it's not painful or uncomfortable.
Yeah. How often does an adult woman, are you supposed to get a pap smear? Or is it by age group?
So, ages 21 through 29, it's every 3 years. Ages 30 to 65, it's every 3 years with a pap test done, or every 5 years if combined with an HPV test. Okay, back to our history lesson. The birthing position.
Oh, don't get me started
What?
on the birthing position.
Tell me about it.
Because when you had a cord prolapse and they keep telling you to be on your effing back, when the only thing that was keeping her heart rate up was that you were not on your back. And as soon as you went on your back and they kept telling you to go on your back once we got to the hospital, her heart rate tanked. And you did a lot of labor with our with number 3 not on your back. And wasn't that a better position for you?
That was a better position. Now, the cord prolapse thing is a little bit of a different situation.
Yeah, I'm salty that because they didn't make you go on your back in the ambulance.
No, they listened to me in the ambulance. Yep. That was good.
Love that paramedic.
So there is historical accounts that suggest that King Louis XIV had many children and mistresses and really enjoyed viewing births and preferred women to give birth in a reclining position, supine position, which is the back, laying on your back, because it gave him an unobstructed view.
Dude, that is... Okay. That's weird.
However, so that's like a rumor that's how this whole thing started.
Okay, so that's out there somewhere.
However, while the king's interest may have been contributed to the popularity of the lying down position, the wider shift started in the late 16th to 17th centuries and was influenced significantly by medical figures such as French doctors. There was a specific French doctor. He promoted this birthing position as it was more comfortable for the mother, he claimed, and allowed better access for midwives and physicians.
Okay, but before this, what was the birthing position?
A lot of women squatted.
And that's probably what midwives were using that position?
Yes, because midwives would attend births and a lot of women squatted or were in alternate birthing positions that opened up the pelvis more.
Right. And then you get medical professionals that are saying, on the back.
Yeah. So the reclining position gradually gained favor and became dominant, especially in Western culture, despite the fact that upright or squatting positions are generally more natural and beneficial for labor due to the effects of gravity and the opening of the pelvic outlet.
Yeah.
So truly, ultimately, it was just better for physicians. It was more convenient for physicians.
Well, because you could see everything.
Exactly.
Oh, so kind of like how the speculum was more convenient for physicians?
Yes.
I'm noticing a theme.
There's a theme here in obstetrics.
Kind of like how it's more convenient for some OBs to do a C-section instead of let the labor go on.
I've met a few. So giving birth in a squatted position can actually increase the pelvic outlet diameter by approximately 20%.
That sounds significant.
Compared to lying on your back.
Is that talking about like how far you're dilated?
This is like the bones in your pelvis.
Oh, because they separate, right?
Yes.
Yeah.
So when you're lying, it's compressed.
Oh, yeah, sure. So
but when you're squatting, it opens up.
Yeah. Because you're not lying on a surface that's holding the bones together more due to the pressure from gravity of your rest of your body.
And this reduction in space when lying down can contribute to higher risk of labor difficulties or increased need for interventions and longer labor durations.
Got it.
Upright positions help by increasing the pelvic dimensions and facilitating the descent of the baby through the birth canal via gravity.
Oh, yeah, because then because obviously you have gravity working with you then.
Right. So when you're laying on your back, you don't really have gravity either on your side.
Yeah, because the birth canal is just horizontal.
Yeah. So yeah, the birth position, rumored to start with King Louis, however, really got popularized and is still the choice for birthing position in Western society, even though we know it is probably the worst for the pelvic outlet and progression of labor.
Do you think if a woman goes into labor and is delivering at a major teaching hospital, like we're in Chicagoland, so I'm thinking Northwestern or Rush or something, are they going to be laboring on their back still, or do you think those medical institutions that are decades ahead of the ones that are suburban or rural, that they're allowing women to labor not on their back?
I think it truly, truly depends on your provider.
Yeah, okay. That's fair.
Now I'd like to talk a little bit about the history of pain management in childbirth.
So are we going to talk about the epidural?
Yeah, we'll talk about it a little bit. Yeah.
Okay, I know that word.
But first, you know that word. Good job.
Thank you.
First, we have to talk about how in Western societies, especially through the Middle Ages.
Ooh, that's a dark time, man.
Both religious and medical authorities opposed pain relief during childbirth.
Oh, the authorities that were also male.
Yeah. Do you want to know why?
Sure. I'm some superstition.
Do you want to guess?
Okay, hold on. Oh, yeah, because it's the consequence of sin and you should feel it?
Exactly. This was justified.
How did I know?
Yep. By citing doctrine such as the belief that pain was God's will for women in childbirth.
God wills it.
Yep. And they would reference Genesis 3:16, referencing the curse.
Unbelievable. But
do you want to know how unbelievable this was?
Sure.
To the point of where there's one infamous woman, I'm going to really mess up her name, Euphame Macalane, in 1591, who was rumored to be burned at the stake in Scotland, reportedly after asking for pain relief during childbirth.
Just for asking for it?
Yes.
And they burned her? It's unbelievable to see the abuse used, the abuse done by using the Bible, especially now that I'm in graduate school for a master's in theology, concentrated in biblical studies. So the biblical part. And I'm learning all kinds of stuff that is not taught over the pulpit. Don't know why. And then I hear crap like this, and I'm like, I can't even begin to unpack the fallacies there. And it's just horrendous.
It is horrendous.
Every generation there's crap like this.
Well, yeah. And I mean, the Bible has notoriously been weaponized against women.
Oh, yeah. And minorities.
Yeah. Notorious.
Yeah.
So in 1847, James Young Simpson pioneered the use of ether and then chloroform for painless labor. And it was super criticized because of this whole religious thing. But it gained broad attention after Queen Victoria used it in 1853 during her childbirth. Nitrous oxide was introduced later in the 19th century as a less potent but safer anesthetic.
Is that laughing gas?
Yeah. Mm-hmm. So these advances, though, were initially met with resistance, obviously, from doctors and clergy members, but were embraced by many women and early feminists. It became a feminist thing who saw it because you had to be a feminist to see, this was you were labeled a feminist back then if you thought pain relief was a woman's right during labor.
It's a pretty low bar.
Just think about over time, people are going to look back though today and see what labeled you as a feminist and be like, that was a pretty low bar. That's you wanted equal rights. That's a pretty low bar.
Yeah. You want medical studies for pharmaceutical medications to include an equal number of women as men?
Pretty low bar. Pretty low bar.
Yeah.
So yeah, that was the low bar back then, right?
Okay.
In the early 1900s, they introduced twilight sleep, where they combined morphine and scopolamine. They called it twilight sleep. It gained popularity, particularly in Germany and the US. Do you know what this did?
I'm guessing it put you to sleep.
Have you ever heard of it?
I don't think so.
Okay. This method caused amnesia. So women did not remember the labor pain.
Oh, that's okay.
But often still experienced it during delivery.
We just wouldn't remember it after.
So women were injected repeatedly with morphine and scopolamine. I'm totally messing that up. Throughout labor. They were placed in a darkened room, soundproof usually, because the scopolamine caused delirium and heightened sensitivity to light and sound and caused hallucinations. Women were restrained with wrist straps or straitjackets to prevent injury because the drugs caused violent thrashing and sometimes self-harm because of the hallucinations. Sometimes nurses used padded masks or gags because women screamed or bit themselves. So it was not painless. The drugs did nothing to eliminate the contractions or the physical trauma of the labor. Women still felt it. They just didn't remember it afterwards.
Yeah. Well, their body would remember, though.
But they were, yes, exactly. They were stripped of agency. Many couldn't consent or withdraw consent once the process started. And the side effects of mothers, psychological trauma. Even though memory was suppressed, many reported lingering terror, hallucinations, or a sense of being assaulted.
Yeah.
Women would have physical injuries because they thrashed so violently that some suffered dislocated jaws, bruises, or broken bones. The intervention skyrocketed because women were unconscious, like in this twilight zone, right? And doctors freely used forceps, episiotomies, and aggressive interventions to get baby out. And then mothers would wake up with no memory of giving birth and holding a baby that felt alien to them.
Oh, right.
Because they were just like, given a baby, here's your baby.
Yeah.
It caused respiratory depression for infants.
Sure, because they're going to have morphine in their systems, right?
Yeah. Though it was rarely recorded as being directly caused by twilight sleep, neonatal deaths and injuries correlated with its use. So there was like a correlation there.
Yeah.
Causation still out, but there was a correlation there.
How long did this practice go on for?
It was widely used the most between 1910 and 1935. But it had scattered use continuing all the way up to it had about a 50 to 60 year lifespan.
So we got 25 years of just cranking out new moms with dislocated jaws, all kinds of psychological terrors and physical harm and worse outcomes for baby just for 25 years.
Yeah. It just shows that women's pain was considered acceptable. And the memory erasure was what was valued more than actually relieving their suffering.
Yeah. Yeah, well, it's like how people can treat very young children and babies. Oh, they're not going to remember it, so, it's fine. Like when a baby boy is circumcised.
Yeah, that's true. They act like, it's good to do it. He's not going to remember it. And they usually don't give pain medication. I mean, if anything, they give Tylenol.
Yeah, that's it's a human person who, whether they remember it or not.
Yeah, that's
how I feel about this twilight sleep.
Yeah, it's interesting because it was marketed as liberation. Magazines called it a miracle that freed women from the curse of Eve. But feminists later criticized it as the opposite of liberation because women were literally silenced, restrained, and made absent from their own births. Yeah,
that absence is because, like you mentioned, that baby would just be totally. You didn't experience the birth with the child, so then it's just like, here's this kid.
It's interesting though, because there are echoes that linger today, like obstetric violence, this over medicalization, and this dismissal of women's reports of pain. Like, this is a theme. But from the mid 20th century onward, you started getting epidurals and spinal blocks. They became the gold standard for labor pain relief. And continuous epidural techniques developed through the 60s to 90s, and it allowed women like significant pain control during labor while maintaining some mobility and participation in delivery.
When you're conscious.
Yes, you are conscious, so that was a big deal. Next, I want to move on to the history of episiotomies. An episiotomy cuts the vaginal opening to make it larger. It was adopted so it was like first recorded ever in like 1742, but it was adopted in medicine in like the early 19th century and really promoted in Europe and in the US as the obstetrics became professionalized. And by the early 20th century, it was standard practice in hospitals, especially in the US. And it was often performed without explanation or consent.
So they would just cut you?
Yeah, they would just cut you. And doctors framed this as preventing severe tearing. The ideal was a clean surgical cut would heal better than a ragged tear. They also said they were protecting the pelvic floor, claiming that it would prevent incontinence or prolapse later in life. They said it would speed up delivery, which was helpful in an era of twilight sleep when forceps were being used a lot during birth. But it also allowed some control of the birth, and it sped things along quicker. So by the 50s to the 70s, in some U.S. hospitals, up to 90% of first-time mothers received an episiotomy, usually without consent. It was just part of giving birth. Research in the 80s and 90s showed routine episiotomies didn't prevent tearing, prolapse, or incontinence, and in fact, it often made them worse. That healing from a natural tear is usually quicker and less painful than healing from a surgical incision, is what they discovered. And then international guidelines started to shift, and the World Health Organization and the American College of Obstetrics and Gynecologists now recommend restrictive use only when medically necessary. So like severe fetal distress or complicated shoulder dystocia, things like that. So rates have significantly dropped, especially in high resource countries, though in some hospitals it is still overused. And there can be complications from episiotomies like infections or excessive bleeding.
So if you were born in the 80s or 90s, then most likely your mom had an episiotomy when you were born. Most
likely, statistically speaking.
So it was like 90% you said up through the 90s?
9 out of 10. Yeah. So in 79, about 60 to 63% of all vaginal births involved an episiotomy. And then by the 90s, that ended up being around 90%. I mean, between the 80s and 90s, that ended up being about 90% of new moms. This is first-time moms. Luckily, by the 2010s, rates in many developed countries had fallen to around 10 to 20%.
Oh, thank God.
There was a doctor that I worked with. Every single patient, did not matter what number baby this was for you. Every single patient, routine episiotomy. Every single one.
Jeez.
It's interesting because it's kind of an example of how this innovation, like, oh, this was an innovative thing, became normalized without real evidence.
Yeah.
And how long it took medicine to reverse course once women started demanding like proof of this evidence. Like people started pushing back against it. And then, it comes out that actually it doesn't help prevent these things. It makes them worse.
Yeah.
I don't know. Do you think that these women were saying that it made it worse? Probably. And they probably weren't believed.
That's a good point. I wonder what the stories are there.
Yeah. Then you have the husband stitch.
Right.
That practice dates back to about the mid-20th century, especially in the 50s to 70s, when the routine episiotomies and surgical repairs after birth were really common, all the way up through the 90s. But the term husband stitch, for those of you who don't know, refers to adding an extra unnecessary suture while repairing a vaginal tear or episiotomy, supposedly to tighten the vagina for a husband's sexual pleasure.
It makes no sense scientifically. It makes no sense. Am I right?
I agree with you. I don't think it makes sense either because they're not doing it like internally.
Exactly.
This is externally. The only thing it's going to do is cause a woman more pain.
Exactly. It makes no scientific sense.
It was never a medically recognized procedure. It was more of like a obstetrical culture kind of thing that was like a sexist thing that some doctors actually carried out. So it wasn't like officially a routine thing, but it was widely enough known that men would sometimes request it. And a lot of women didn't know what was happening to them or that it was being done because they're not like watching the doctor perform anything down there. And also, how would they know?
Yeah. So you started having, so you start having pain in sex.
Yeah. And there's no reliable statistics as to how often this actually happened. But we did a post on this on TikTok once, and the comments were overflowing with women who had that happen to them.
Yeah, that was crazy. I remember that.
And it's not obviously done with consent. It can cause severe pain during healing. The vagina is stitched too tightly, making walking and sitting excruciating. It can cause painful sex, pelvic floor dysfunction, infection, additional suturing that's unnecessary, psychological trauma. Obviously, women feel and describe it as a violation or a form of obstetric assault. And it can cause strain on relationships because intimacy becomes more painful.
Yeah, there's absolutely zero benefit to that for the woman.
It's sexism, prioritizing male pleasure over female autonomy.
Yeah, that's really what it is.
It's also medical paternalism, doctors making decisions without consent.
Yeah.
And then, of course, women in pain probably are being silenced or being like, oh, that's just normal.
Yeah, being gaslit about it.
Yeah.
Yeah.
We also have a huge birth trauma issue here in the United States. It's a significant issue that affects more women than what I even realized when I started doing this research. About 25% to 45% of new mothers report experiencing some form of birth trauma.
Oh, that's high.
With figures varying due to different definitions and measurements used in these studies, which is why it's like 25 to 45%.
Yeah, it's quite the spread.
Yeah. But approximately 1.5 to 6% of women will develop full post-traumatic stress disorder following childbirth, with some studies reporting up to 17% or higher rates, depending on risk factors, like if they had emergency C-sections or complications.
Now, is this compared at all to like a different type of control group, like a different country, or women who don't have X, Y, and Z done during birth?
They found that the more, I don't think it's compared to another country as a control group, but they found that women, this isn't like, X% amount of women have it more than another group of women.
No, I know
but it is talking about how the likelihood of you having PTSD specifically increases greatly with interventions.
Okay, got it.
So 1.5 to 6% is just like general all births. But they see that number goes up to 17% or higher. Like that these women meet the markers for full post-traumatic stress disorder.
Yeah, okay, that makes sense. The reason why I was asking is because I didn't know if, these numbers are what the case would be just for women having birth in general. How do we know that it's a medically induced problem? But your explanation makes sense.
Yeah, because we find with more intervention comes more trauma.
Yeah.
I mean, I think birth is traumatic regardless. I get what you're saying. Like, I think that it is something that you cannot prepare yourself for. And it is something that is always shocking.
Yeah.
But I think that it can be done very beautifully. And it can also be done really horrifically. And sometimes, even in our experience, we know that even the horrific part of it was necessary. So just because something happened horrifically doesn't mean it wasn't necessary.
Yeah, that's a good observation.
So you might end up in that 17% or higher rate, and it was something that had to be done to save your life or to save the life of your baby.
Yeah.
A survey found that only 40% of people were even aware that childbirth can lead to PTSD, pointing to like a widespread lack of recognition that birth is a potential psychological trauma producer, Yeah. Research suggests that around 1 in 3 women experience childbirth as psychologically traumatic, but not all will develop PTSD, but about 1 in 3 will experience it as psychologically traumatic.
Dang.
But the ones that do experience PTSD, it's like flashbacks, nightmares, hyperarousal, anxiety, difficulty bonding with baby, which I I'm very lucky because I don't feel like I suffer from it anymore. But right after my traumatic birth, like I totally had a flashback. It was wild. I don't know if you remember that when we were in the hospital and I got up to go to the bathroom by myself.
Oh, yeah, I remember that. Oh,
and
shoot.
I was like transported to when I went to the bathroom by myself at home and I discovered that I had my cord prolapse. The umbilical cord was outside of me.
Yeah. Anytime you went, for a while, wasn't it? Anytime you went to the
yes,
bathroom.
like I needed you to come with me. And I was scared to go to the bathroom in our own bathroom here at home.
Yeah, I remember that. Yeah.
Because it was like something completely out of my control. Like I couldn't control it. It just like, I was just like transported there. It was wild.
Yeah. And I remember it was a big deal when you realized that had subsided.
Yeah. Yeah. Finally, after so many things. But unfortunately, many women with birth trauma symptoms are misdiagnosed with postpartum depression or other conditions and are basically kind of told to move on without really proper treatment or kind of that attitude contributes to low rates of professional help. You know, this kind of like, you feel like it shouldn't be as traumatic as what it was. Like you feel like, not all women do this, but there's a lot of women that do this and they walk around like everything's okay. So like I should be okay. But I'm not.
What is the proper treatment for that type of PTSD? Like if you're misdiagnosed as postpartum depression and you said something about not getting the right treatment, what is the right treatment?
I mean, the right treatment would be getting into counseling, would probably be EMDR, would probably be working, you know, the treatment for PTSD.
Right. Duh, that makes sense.
You would treat it as PTSD.
Right, versus depression.
Yes.
Which are
Very
dramatically different.
Yes. The last haunting thing I want to talk about is maternal mortality rates, which we have touched on before, but this childbirth episode would not be complete without it. So the maternal mortality rate in the U.S. was approximately 18.6 deaths per 100,000 live births in 2023, which was down from 2022, which was at 22.3. But we are still significantly higher than other high-income countries like Sweden, Japan, the UK, where rates are often under 10.
Oh, so we're like double.
Yeah.
Just about.
And Black women experience dramatically higher maternal mortality rates, nearly 3.5 to 4 times higher.
Oh my gosh. Whoa.
It's a lot.
That's dramatic. Are there any indications as to why it's that disparity?
Oh, systemic racism has something to do with it. But
I know that.
There's arguments saying that, oh, well, they suffer from preeclampsia more. They suffer from high blood pressure more. They suffer from some of these comorbidities more. But does not account for that dramatic of a difference. Mm-hmm. Like if you look at like white women that suffer from preeclampsia and high blood pressure and Black women that suffer from preeclampsia and high blood pressure, it does not make up, that difference. There's racism that happens here.
So it's that type of care.
Yeah. American Indian and Native women also face high mortality rates that are more elevated than white women. And then Hispanic and Asian women also have higher mortality rates than the white population. So basically white women fare the best.
Yeah.
Which again, if you're looking,
surprise,
I know, like that's the thing is it's like if you can't just explain it all away with preeclampsia and high blood pressure when every other demographic also has higher mortality rates.
Right. Yeah.
So it is linked to, like I said, systemic healthcare inequities like racism and things like that, chronic conditions, lack of access to care, consistent prenatal care and postpartum care. It's interesting, though, there is wide state-to-state variations, with maternal mortality rates ranging as low as 18.5 to as high as 59.7.
Whoa. Do you have some winners and losers
per
for
100,000 deaths?
We got some
per 100,000 live births.
Right.
Louisiana currently has the highest maternal mortality rate. As of 2025, it is reported to be 58.1 deaths per 100,000 live births.
And is that on average, or is that just for white women?
That's on average. This rate is 4 times higher for black mothers in Louisiana.
So like over 200?
Yeah. And nearly 59% of black maternal deaths are considered preventable, compared to only 9% for white mothers.
Oh, that's chilling and telling.
Yep. Georgia comes in at 48.4, Indiana 43.6, Tennessee 41.1, Mississippi 39.1.
Okay, where's some winners? We got
Vermont, baby.
What are they at?
1
Whoa!
maternal death per 100,000
Oh my
live births.
gosh.
It is a small place, though.
Yeah, but it's
Rhode
a rate.
Island at 9, Delaware at 9, Maine at 7, California at 10 to 11, Massachusetts at 8.4, Connecticut at 10.5, New Hampshire at 11, Alaska at 12, Hawaii at 13, and Minnesota at 12.3.
Huh. You can edit this out. Aren't those all blue states? And all the other ones are red states?
I think that is an accurate observation.
And I wonder if you were to compare like income and education level, is it because these people are poorer and have less adequate health care in these countries or these states that don't perform well? Because the Northeast, I think it's more well off than the Southeast.
Well,
you got
there's
California
probably wider
in there.
Medicaid coverage that is available
And how would that factor
in blue states than red states. Because then you have health care, you have health insurance.
You said Medicaid?
Yes.
Oh, and then so like in these other states, you wouldn't have as many people on Medicaid?
Access to Medicaid is more prohibitive.
So if they're just a self-pay, they're not going to get as good of care?
Well, no, they're not going to get care.
They just won't do the stuff?
They're going to show up and whoever's on call is going to deliver them. That happens all the time around here.
Okay, wait. But if just the person on call is going to deliver them, how would that lead to a worse outcome?
Because let's say this person had preeclampsia and didn't know it.
Yeah. Because they didn't have any prenatal
Now they're
stuff?
now they're in a hypertensive crisis.
Because they didn't catch stuff prenatally.
Yes, exactly. They had no prenatal care.
Okay.
No prenatal care in our hospitals locally is an automatic social service referral.
Really?
Yes, because it's considered neglect.
Huh, I didn't know that.
States with restrictive abortion laws tend to have higher maternal mortality rates, particularly for marginalized populations.
Yes. So there's a correlation there.
There's some kind of correlation there, yeah.
Some type.
And the U.S., this is what I found interesting, the U.S. maternal mortality rate is currently the highest it has been since when do you think in the United States comparatively?
1991.
Lower.
1964.
The 1960s.
So it's higher now than it was in the 60s?
It's high. The last time, yes, the last time it was this high was in the 1960s.
So it's been getting worse.
Yes, exactly.
Why?
That's a great question. Do you think it could be healthcare access? Do you think it could be...
Well, healthcare costs have risen and far outpaced income levels.
Yeah, and I will say also, there are more complicated cases getting pregnant these days. Like you have with the invention of the IVF, you have higher risk demographics being able to get pregnant. You have older women being able to get pregnant. You have women who otherwise wouldn't be able to carry a baby being able to get pregnant. So there are like pregnancies that are happening that would not have happened.
Yeah.
Probably.
Well, there's microplastics. There's more preservatives and more ultra processed foods, and our diet's worse.
Yeah.
Our body's probably inflamed. Don't even get me started on Teflon. I mean, at least we got rid of leaded gasoline.
Yeah. Yeah, just is not a good look. It's not a good look.
No, it's not a good look.
And
not a good reality.
It doesn't seem like anybody's super concerned. Yeah. Because I feel like we're going backwards. Mm-hmm. When it comes to women's health care.
I mean, it's pretty scary stuff.
That is pretty scary stuff, and it's not just in the past. Some of this stuff's happening today. But it's echoes from the past, There's this general just dismissiveness of women's pain and autonomy and experience for the convenience of others.
Yeah, history just repeats itself.
Yeah.
It's really sad.
It is.
I hope for those of you listening, something was intriguing or sparked a curiosity, or you felt affirmed or challenged. Stay educated. Take the pink pill. If you enjoyed this podcast, please give us a follow and maybe a nice review.